Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes once again. And today we need to execute this task where we are in the emergency department of a local hospital. 35-year-old patient was involved in a car accident earlier today and is now suffering from a headache and a whiplash injury. So basically, it's very simple that a patient had an accident. So he has suffered from headache and whiplash injury. He is being kept in the hospital for observation, but is expected to be discharged later in the day. That means he was involved in the morning time. That is why they are saying earlier. So morning he had an accident and in the evening he would be discharged. So meanwhile he is in the hospital for observation. So meanwhile we are observing the patient. So that is the main point about this speaking task. Then let us see what are the situations, what are the tasks that you have to cover. So you get the marks for these things. Find out what the patient thinks are the reasons why he is being kept in the hospital. So rather than finding out, it's better to say, matlab means they want to tell you to ask, do you know why are you in the hospital? So that is how you should ask the patient. Find out, do you know why you are in the hospital? So patient will say no, and then you will say, see, you are being kept. You are being kept. You or are. Baki sab same. You are being kept in the hospital for observation. Advise the patient on the reason for taking and continuing to take medication and the ways of managing the pains once she returns home. So you can say that as you had an accident, so it is very important for you to take and continue the medications as prescribed by the doctor. And also you might suffer from pain. So it is very important for you to take all the precautions, all the things that has been told by doctor, like you have to use heat pack, ice packs. Also you need to take painkillers on time. Also we will provide you a collar. You need to wear the collar as you had a car accident and you had a whiplash injury, which is kind of an injury to the cervical spine. So collar is very important to stabilize your cervical spine. थर्ड, तो बेसिकली कॉलर इसलिए यूज करना है ताकि इसको स्टेबलाइज कर सके, क्योंकि कई बार इंजरी इनसाइड इंजरी होती है, आपको बाहर से विजिबल नहीं होती, इसीलिए तो हम आपको ऑब्जर्व कर रहे हैं. अगर आपकी एक्सटर्नल इंजरी होती तो दिख जाती है, लेकिन जब आपका एक्सीडेंट हुआ है, हेडेक हो रहा है, आपको विप्लैश इंजरी है, तो हमें ये ध्यान रखना पड़ेगा कि जो भी प्रिकॉशंस है हमें लेने पड़ेंगे. ओके, सो ये इसी में कवर हो जाएगा पॉइंट. बेस्ट प्रैक्टिसेस. Describe the benefits of consulting a physiotherapist. फिर उसको कहो, as your injury is mainly related to spine, so it is very important to consult to physiotherapist. He will tell you about the exercises and also he will guide you for the relaxation exercises to loosen up the joints. Explain that you cannot be sure how long the patient will take to recover as your injury is internal. इसमें मेन पॉइंट यही है, इंजरी इंटरनल है, तभी आपको हॉस्पिटल में रख रहे हैं, तभी हम कह रहे हैं प्रिकॉशंस जरूर लेने चाहिए. That is why it is important to consult a physiotherapist. और fully recover करने का हम पक्का नहीं बता सकते, पर 1 to 2 weeks में आप recover हो जाओगे. Stress the importance of complying with the treatment and exercise program. जो भी आपको physiotherapy exercise program बताएगा, उसको अगर आप follow करोगे तो your recovery would be faster. Stress the importance of seeking medical advice if there is any increased pain. अगर गलती से पेन बढ़ जाता है तो आपको एकदम मेडिकल एडवाइस लेनी है. और उसके अलावा डिस्कम्फर्ट, नोज या वोमिटिंग या विजन प्रॉब्लम्स, ऐसा कुछ भी होता है तो आपको डॉक्टर को इमीडिएटली कांटेक्ट करना है. सीकिंग मेडिकल एडवाइस का मतलब, मेडिकल एडवाइस का मतलब डॉक्टर से एडवाइस लेनी है. सीक का मतलब ढूंढना, तो मतलब फटाफट आपको डॉक्टर से मिलना है. सो अगेन यू विल गेट 3 minutes टू प्रिपेयर. वैसे तो मैंने ये टास्क पूरा बोल दिया, लेकिन फिर भी जब आपको पेपर में मिलेगा तो आपके पास 3 minutes होंगे लिखने के लिए. 5 minutes आपको बोलना होता है, जैसे मैं हमेशा बताता हूँ. तो आप कहोगे गुड मॉर्निंग, my name is this and I am your nurse for the day. So how are you feeling? अगेन मैंने आपको बताया ये लाइन सबको लिखनी है. अगर आप आज भी प्रैक्टिस करते हो टीचर के साथ तो आपको ये लाइन जरूर लिखनी चाहिए, जरूर हमेशा लिखनी चाहिए आपको. ये फॉर ग्रांटेड नहीं लेना चाहिए कि आपको आता है. सो हाउ आर यू फीलिंग नाउ. पेशेंट बताएगा कि पेन है और हेडेक है मेरे को, तो आपको बताना है. सो बिफोर आई कैन एक्सप्लेन यू, बिफोर आई कैन हेल्प यू, जो आपका हेडेक है और पेन है उसके लिए तो मैं आपकी हेल्प करूंगी, But before can I help you, do you know, I would like to ask you, मैं आपसे पूछना चाहूंगी, like to ask you, do you know what is the reason, what is the reason of keeping you in the hospital? आपको पता है आप यहाँ पे किस लिए हो? वो कहेगा नहीं मेरे को तो बिल्कुल समझ नहीं आ रही, क्योंकि एक तरफ से तो आप मेरे को कह रहे हो मैं ठीक हूँ, आई एम ऑल राइट, एट द सेम टाइम डॉक्टर हैज केप्ट मी इन द हॉस्पिटल, दैट इज व्हाई आई एम सस्पिशियस, कि कुछ बात है जो आप मेरे को नहीं बता रहे हो। तो आप कहोगे नो देयर इज नथिंग लाइक दैट। ये लाइन बड़ी इंपॉर्टेंट है, जब भी पेशेंट आपकी बात नहीं समझे तो आपको ये लाइन जरूर आनी चाहिए। तो इसकी इस लाइन की बहुत प्रैक्टिस करो कि नो देयर इज नथिंग लाइक दैट, यू आर बीइंग केप्ट इन द हॉस्पिटल एज you had an internal injury, also you are having headache, और आपकी सर्वाइकल स्पाइन भी तो इन्वॉल्व है, एंड योर सर्वाइकल स्पाइन इज इन्वॉल्व, तो आपकी सर्वाइकल स्पाइन भी इन्वॉल्व है, तो इट इज इंपॉर्टेंट टू ऑब्जर्व यू। तो इसीलिए हमने आपको हॉस्पिटल में रखा है, बिकॉज इट इज इंपॉर्टेंट टू ऑब्जर्व यू। अगर आप सच में देखोगे, वैसे मैं ज्यादा लिख रहा हूँ बट आपका इंग्लिश पे कंट्रोल होना चाहिए, बट मुझे आपको पढ़ाना है इसलिए मैं ज्यादा लिख रहा हूँ। पर अगर इतना लिखना भी पड़े तो आपके पास टाइम होता है, 3 मिनट्स में लिखा जाता है, इट इज नॉट अ बिग डील। देन फिर तो टास्क सिंपल चलेगा। नाउ आई वुड लाइक टू एडवाइज यू दैट इट इज इंपॉर्टेंट टू टेक मेडिकेशंस as prescribed by the doctor, and also to manage your pain. It is once you return home, it is important to use hot and ice packs alternatively. You should use hot pack after 1 or 2 hours, you should use ice packs, then again hot packs and ice packs alternatively. Apart from this, painkillers are very important to relieve your pain. Also, okay, a collar will be provided to you. Passive voice, a collar will be provided to you which will stabilize your spine, so please wear that collar which will stabilize your spine. Please wear that collar. Apart from also, consulting a physiotherapist is very important, as your injury, as physiotherapist can tell you about the relaxation exercises to loosen up your joints, so you will feel better. So it is very important to see a physiotherapist. But nurse, how much time would it take? See, as it is an internal injury, as का मतलब होता है because, तो इसका तो यूज करना पड़ता है as it is जब भी, क्योंकि वो आपसे क्वेश्चन पूछता है, तो क्वेश्चन का आंसर आप क्या दोगे? क्योंकि में ही दोगे, क्योंकि का मतलब as या because में ही दोगे, as it is internal injury, so we can't be sure. It might take 2 to 3 weeks या 1 to 2 weeks, but you will be fine. Further, to recover quickly, it is very important to comply with the medications as prescribed by the doctor and all the treatment regimes that has been given to you, and also the exercises. तो सब कुछ फॉलो करना है जो हमने आपको बताया। ये वाला बात इट इज इंपॉर्टेंट टू बी नोटेड। जो लाइन अलग से होती है, अब सारी पॉजिटिव बातें खत्म हो गई हैं, इट इज इंपॉर्टेंट टू बी नोटेड। इस बात को ध्यान रखना कि अगर कुछ भी होता है, इफ देयर इज एनीथिंग लाइक इंक्रीज पेन, डिस्कम्फर्ट, नोजिया, वॉमिटिंग प्रॉब्लम, इफ के साथ देन का कॉम्बिनेशन, इफ then it is important to seek medical advice. Then it is important to seek medical advice. अगर आपको medical advice नहीं समझ आ रहा था तो ये कह दो, it is important to seek medical advice. Now your task is all done. 2 बार मैंने बोल दिया, अब होता है मेन फ्लुएंसी, जो आपकी प्रैक्टिस से बढ़ेगी। सो मैं आपको पूरा बोल के दिखाता हूँ पेपर में कैसे होगा। Good morning, my name is Bhupesh and I am your nurse for the day. So how are you feeling now? Oh nurse, I'm not feeling good. Could you please tell me what are you feeling at the moment? What is bothering you? Well nurse, I am having headache. Also there is lot of pain in my cervical spine. I don't know what's going on, and moreover doctor is saying that everything is fine, but he is keeping me in the hospital. So I'm really confused. Okay, so before I can help you, I would like to ask you, do you know what is the reason of keeping you in the hospital? Nurse, I am asking you the same thing. Okay, so let me tell you that we are being kept in the hospital for the observation purposes. As such, you are absolutely fine and you are expected to be discharged later in the day. So there is nothing to worry. But at this moment, it is important to observe you as you had an internal injury. Also, you are having headache along with you are having injury to the cervical spine, which is known as whiplash injury. So in the cases like these, it is very important to observe for 8 to 12 hours. So that is why you are being kept in the hospital. Is it all right? Have you understood? Yes, nurse, I have understood that you are keeping me for the observation. But nurse, like, would I be fine? Yes, you will be absolutely fine. As I have already told you that you are expected to be discharged later in the day. So there is nothing to worry. Further, I would like to tell you that it is very important for you to take medications. Medications play a very important role in the recovery, and also they decrease the inflammation and relieve your pain. So analgesics on time will play a crucial role in your recovery. Apart from this, once you return home, it is important to use hot and ice packs alternatively. That means wherever you feel the pain, it is important to apply the hot pack. Then after 2 hours, you should apply the ice packs. Reason for applying the hot pack is that it improves your blood circulation and loosen up your joints, so it provides warmth and relieves your pain. Whereas ice packs decrease your inflammation. So they both play a very important role. That is why you should use it alternatively. Last but not the least, collar would be provided to you, which will stabilize your spine. So it is important to wear those collars as would be told by the doctor. Is it all right? Have you understood? Yes, nurse, it's all good. I have understood. Okay. Now I would like to tell you that physiotherapist appointment is also very important. His consultation will also be very important for your recovery, as he can guide you about the exercises and relaxation exercises to loosen up your joint. So whatever the pain you are feeling at the moment is basically due to the stiffening of the joints, which happen after the accident. So for these things, physiotherapists are the experts. So it is very important to consult a physiotherapist. Should I fix your appointment with the physiotherapist? Yes, nurse. Okay, so I will fix your appointment. But nurse, how much time would it take for the complete recovery? See, as your injury is internal, so at this moment it is very difficult to say what time would it take. But still, it will take around 1 to 2 weeks. Normally, the patients like yourself recover in 1 to 2 weeks. So there is nothing to worry. If there is no complication, you should recover within like maximum couple of weeks. Okay, nurse. And anything else? No, the most important thing again, I would like to remind you that to comply with the treatment and exercise program is very important. It is imperative and necessary to follow the instructions which I have mentioned above. Also, I will give you a leaflet in which all the instructions would be given, and you can read the instructions whenever you feel uncomfortable. In case if you forget anything, then you can contact us on the number given over the leaflet, so you can call us anytime. Is it all good? Yes, nurse. Okay. Last, but it is important to be noted that if there is any increased pain or discomfort, nausea, vomiting, or any vision problems, in that case, it is very important to seek medical advice immediately. So don't do any delay if there is any discomfort, nausea, vomiting, or vision problems. In that case, it is important to contact the doctor immediately. I hope you have understood everything. Yes, nurse. All right. Then that's great. Here is your leaflet and you will be discharged very soon. And there is nothing to worry. You are absolutely fine. And rest, if you will have any issues or any doubt, you can contact us on the number given over the leaflet. So you can call us on that number anytime. Okay. All right. Okay, then take care. I'm leaving. And if you need anything, there is a buzzer beside your bed. You can press the buzzer and we are here to help you. Okay, done. So that is how you execute the task. Again, I have told you कि जब आप टास्क को सुनते हो तो उसको लिख के देखो, उसको साथ लिख के देखो, उसको 2-3 बार सुनो, you will feel better and that is how you would become an expert. ऐसे ही आप धीरे धीरे करके experts बनोगे. But listening को speaking को एक बार सुनने से नहीं 3-4 बार सुनना पड़ेगा. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.